Well, good morning, everyone. First off, who has heard of or knows about ORCAA? Anybody know about ORCAA? So maybe half of you. So Olympic Region Clean Air Agency is your local clean air agency. We enforce local, state, and federal clean air laws on the 6 counties of the Olympic Peninsula. So Kaitlyn, Jefferson, Grace Harbor, Mason, Pacific, and Thurston. We're one of 7 clean air agencies in Washington. At the time of the passage of the Clean Air Act in the state, counties had the option of choosing self-rule over clean air laws through a clean air local agency, or letting the State Department of Ecology manage their county. All of Western Washington chose the local route. About half of Eastern Washington chose to stay with ecology. So in addition to the 7 local clean air agencies, there's also the Eastern Regional Office of Ecology and the Central Regional Office of Ecology managing local concerns. For us, we basically enforce, like I said, local, state, and federal clean air laws. Our board is represented by a member from each of our 6 counties and the 3 largest cities within our jurisdiction. So your local representative on our board of directors is Commissioner Brotherton over here. He's our vice chair of the board, does a great job with us. He serves on our finance and personnel committees as well. And then on the policy, what we actually do is, first we register and permit any business with the potential to emit air pollutants. So everything from gas stations to pulp and paper mills. On the residential side, we look at indoor burning, wood stoves, wood heating, and try to make sure people are being as efficient and as clean as possible with their indoor wood burning. Outdoor burning, and then asbestos and demolition. Asbestos is a federally regulated pollutant that we do require permits through our agency when you're doing any demolition projects. Unfortunately, one of the biggest issues we've faced in the last half dozen years is wildfire smoke, and we have no regulatory authority over that. Even if we did, there's nothing we could do about it. Most of the smoke impacts we're seeing the past several years are transitory smoke coming from Oregon, California, Montana, northern Canada, Alaska, even some events from China. So we're seeing migratory smoke in the new atmospheric jet stream patterns and weather patterns. We're getting more intrusive smoke than we've ever seen before. We're also seeing more wildfires and bigger wildfires. And it's something that is an ongoing concern, and it's something that's not going to go away for us, unfortunately. I grew up in Eastern Washington. I've spent my life dealing with wildfires and wildfire smoke. How many of you are Washington natives or have been here for 30 plus years? So if you remember, in the mid-90s, there was a big fire in the Leavenworth area called the Rat Creek Fire. That one, literally, Highway 97, the asphalt was literally on fire. It was so big. I was actually in the enchantments at that time, working on a guidebook, and I had to be hiked out over Asgard Pass through smoke and fire with the rangers there. So it's something we as a Western state are used to. We know there's fires. Western Washington, we haven't seen the big catastrophic events here, but we have seen fires in our jurisdiction. Just 8-10 years ago, we had a pretty good sized fire in the Brennan area where ORCAA came in and put up some mobile monitors so we could keep that community informed of what was going on. And so we try to do that as well. So really, on the wildfire smoke events, that's where we can best serve the community. It's providing information, providing air quality in real time. We do have a brand new website to help us share that information. We do maintain air quality permanent monitors in each of our 6 counties. Here in Jefferson County, our permanent monitor is based at the Blue Heron Middle School. And we do, every few years, we do a saturation study in each of our counties so we can use temporary monitors, evaluate the air quality throughout the county for a full year, and make sure that our permanent monitor is the best represented site within the county. So it's something that's not impacted by short-term localized events. It's something that is going to show when you do have peaks from the standard ambient air throughout the community. So Blue Heron has proven to be a really reliable site to cover eastern Jefferson County. I won't say it's representative of the west side of the county, but we've got a big mountain range between here and there, so it's hard to keep that. We also have a monitor in Port Angeles, and then a national core air monitoring site out at Chica Peak above Neah Bay. So that's a great background site. It gives us kind of the baseline air quality for the Pacific Northwest, because it gets all of the hopefully clean air off the Pacific. So it tells us what's in the air before we add our own pollution. So it's a really good background monitoring site. So our monitoring network, again, we're making sure we're keeping people informed, but we're also making sure we're staying in compliant with national standards. When necessary, especially during the winter months, when we have cold weather and inversions, we do use our air monitoring data to issue burn bans if required, so that we would shut down the use of uncertified wood stoves and any outdoor burning of yard waste and recreational fires. And then if it's really bad, we would ask to shut down all use of wood stoves except when they're the sole source of heat for a homeowner. And again, we have those monitors in each of the 6 counties. There's also air monitoring devices maintained by the Macaw and the Quinault within our jurisdiction. Other networks to be aware of. How many people have heard of Purple Airs? So these are our personal air monitoring devices. That's exactly the entire device. You connect it to a power, and then it connects to your Wi-Fi network at home. You can place this indoors if you want to check your indoor air quality. You can place it outdoors to get real-time air quality around your home or your community. There are some guidelines of how to place this to get actual reliable data, instead of, so you don't want to put it in your carport where you're firing up your diesel truck each morning. You don't want to put it on your chimney where you're getting fallout of any soot coming out. So we do have on our website some installation guidelines, but these have proven to be pretty reliable in that they track well with our established certified data. They do run a little high because of the way they're monitored, but EPA and several local air agencies have studied these for years and found some correction factors. So even though the data runs high, it tracks exactly like the other plot lines. So with those correction data, you can see they consistently overpredict by a factor of about 2, but by applying those correction data, which you can do right in the website for Purple Air, or you can use this site, excuse me, the Fire and Smoke Map, hosted by EPA's Air Now site, incorporates all of the Purple Air monitors in the US within the same map as all of the local agency, state agency, and federally maintained sites. So you can have all of these air monitoring sites in one simple to use web-based graphic. And they're differentiated by size and color, so you can see which are Purple Air, which are federally equivalent methods, and which are local air monitors. And the Purple Air data on that map is automatically corrected, so you don't have to go through that correction factor. Some other sources of information as we see those smoke intrusion events. Probably the best tool at our disposal right now is the Washington Smoke Blog. This is a multi-agency, multi-jurisdictional information site. ORCAA, our air monitoring specialist, is one of the key contributors. Ecology, DOH, DNR, US Forest Service, National Weather Service all contribute to this. It provides real-time updates anytime we have a smoke event anywhere in Washington. So it may not be a smoke event here, but if there's smoke in the Tri-Cities or in Spokane, we'll be posting there. If we do see smoke, looks like it's going to infiltrate our area, we'll get that notices up. We'll post links to how you can stay abreast of where that smoke plume is, where it's coming from, links to Department of Health's website so that you can get the best information on how to protect your health when that smoke does come in. And then again, our website, ORCAA.org, we do have links to all of this on our website. So we can't do anything about the smoke itself, but we can share information. And that's really what we focus on during these events, is being a information hub to get you to the people that can provide better insights. And then as far as how to protect yourself, again, we can't protect you. So some of the things you can do, box fan filters, and I think Kaitlyn might talk about these as well. This is something that's been talked about for a number of years. I think somebody's got one here. It's basically a 20-inch square fan. And the simplest method is to take a 20-inch square filter and duct tape it to the back. That's the simplest method. It does work to some degree. And back there on the table, EPA funded a study last year that just came out in November of 22. And I didn't have copies enough for everybody, but I do have links in my website. But it shows that this Corsi Rosenthal box, which is basically a box of filters on the back of that instead of a single filter, can be up to 2 or 3 times more efficient than the best commercial grade portable filter. So these things work. And by having multiple filters on that fan, you reduce the risk of overloading that fan motor or making it hot. And that was some of the early concerns, was reducing airflow on a very inexpensive electric motor. You could risk creating fire hazards. This study shows that that's really not a concern, especially if you're using a 2-inch filter as a single filter or multiple filters in a Cozy Rosen or even a triangle configuration. So there is some information on that in this flyer over there. And then the other thing we can do, and I'm not sure if I put this on a slide, on the back side of this, we can help during those smoke events by minimizing our contribution to the problem. If we're seeing smoke from Montana, let's refrain from using campfires that weekend or that week or that 2-week period. Let's hold off on the yard waste burning. Let's look for alternatives like composting your yard waste and garden waste, or chipping it or taking it to a commercial composter. So if we can minimize our contributions during those events, it keeps those events from getting even worse. So again, ORCAA's here to provide information, provide a clearinghouse of resources, and to help you as best we can to get in touch with the people that can actually provide the health and messaging about your health during these events. So with that, I'm going to turn it over to Kaitlyn, unless you want to take any questions right now, or do it all after the fact.
Questions for Dan right now?
Thank you for having me.
So I'm the Air Quality Policy Specialist, Washington State Department of Health. I've been in this role. This will be my 4th fire season. So it's, I'm excited, nervous, always during this time of year. It's really hard to predict what we have in store for us over the summer. And I'm sure the heat wave this weekend kind of started to get us thinking about fire season and our fuels drying up and things like that. So in my role, I think policy specialist is pretty broad, but I really lead our wildfire smoke public health response work at the state level. And DOH's role really is to support local health And a lot of my job is doing trainings like this, working with locals. We don't have the jurisdiction at the state level. It really falls to the local level. So it's exciting to partner with locals as we see more smoke events and things like that. I have a lot of content. And so just to get an idea of what to focus on, who, if you could raise your hand, who is a community member or kind of representing a community group? Okay, one. Yeah, just here to attend and learn. Is anyone from a school district or schools or a childcare facility? Okay. Is anyone from like emergency management, local agencies? Okay, got a couple. Okay. If you didn't raise your hand, just an example of an organization you're here with. Yeah. Yes, summer camps for kids. Okay, wonderful. Yeah. Big events, outdoor events. Coach, outdoor, yes, sports events, and one more in the back. Neighborhood preparedness. Okay, wonderful. Thanks for giving me an idea of who's in the room. So we all know fires are getting worse. I really like this map. So one of our good colleagues at the state level is the fire meteorologist and really looks at fire data and trends over time. And I think what's really interesting when we were putting together this map is that in the last 2 decades or so, the increase in large fires in the West Coast has significantly increased. And you can see by that change in the outline. And that increase we saw in the interior West earlier, so in Idaho and Montana and things like that. And so the red dots are really large fires, so above 50,000 acres. And then the gray dots, which do increase as well, are the smaller fires, so any fire over 1,000 acres. And with fire comes smoke, but as Dan mentioned, just because you have a fire, or because if there's a fire in a different state, we all know you can still get smoke. Smoke travels beyond the geographic region of a fire, and the interventions for wildfire smoke and how to protect yourself are pretty different than evacuating, maybe from the surrounding area from a fire. This graph is from the Department of Ecology, another partner in air quality monitoring and forecasting for smoke at the state level. And it shows, this is broken down by the air quality index. So this is how we communicate the hazard of air quality levels. And so the darker colors means it's worse for health. And we are seeing more days having, that are unhealthy, very unhealthy in our summers. And this only does go up to 2021. So it doesn't have the smoke event from last year. And if you were around in Washington for the supermassive smoke plume of 2020, that is a really good example of smoke coming up from other places with these offshore powders and things like that came up and impacted across our entire state for 2 weeks. And then last year we had the October wildfire smoke event, and that looked pretty different and impacted different regions. So it's hard to see, from year to year, smoke is going to look different, but we are going to have smoke at this point. It'll be hard to go probably an entire summer without some smoke impacts in our state. So that's why it's really important to be smoke ready. And so when we think about being ready for wildfire smoke, and smoke ready means prescribed burns or other fires happening too that do impact health. But being smoke ready means that communities and individuals have the knowledge and ability and to stay reasonably safe and healthy during smoke events. And so when I think about that in regards to public health, that means knowing your sources of air pollution and how to access, forecast, and air quality conditions. And that's what Dan's presentation covered and what ORCAA does for your community. And then knowing what's in smoke and why is it bad for your health, knowing the health effects and symptoms so you can track the impact that it's having on your body, and knowing who's at risk and who's has increased risk. And then having the ability to reduce your exposure too is important. So this is the concept that's going to frame most of my presentation for today. And so thinking about that first one, just emphasizing this Washington Smoke Blog is a really great one-stop shop for anything the air quality data, the health information, it has fire information, and I really love there's daily, or frequent blog posts, and it's really professionals like Dan and I writing these posts, answering questions, and it's just a nice way to get that narrative explanation of just beyond the data that's a dot in the color, but actually like where is it moving, why, and things like that. So I think this was a handout that was on the table as well. So this is our guide for air pollution. So this really breaks down what you should do at the different levels of the air quality index. And so it's down by the color categories. Most people, I think, know the air quality index. So it's like, oh, it's orange outside, or it's red. So this is kind of just shows as the air quality worsens and we go into those higher categories, you need to take more steps to reduce your exposure. And so this guide also has those steps on the back, and I'll go through that. And this was in partnership with the Department of Ecology. And this slide is just a little bit zoomed in, and you'll see that people that are in sensitive groups, and I'll go over that list of folks, to start taking actions, or should start taking actions earlier at lower levels of air pollution. So wildfire smoke has a lot of things in it. It's a mixture of air pollutants, but when we focus on air quality monitoring or thinking about the health impacts, we usually talk about PM 2.5 or particulate matter 2.5. And that is most of the mass emitted in wildfire smoke, but it's also the one when we think about the health effects and the particular risk of it. So this is our classic image of PM 2.5. It's showing how small it is in reference to some, the human hair or sand. And 2.5 refers to the size of the particles, so 2.5 microns or smaller. And so the particular risk of this air pollutant is that it's so small that it can really get into your lungs and then into your bloodstream. And so that's why we also see some more cardiovascular impacts related to wildfire smoke, not just respiratory impacts. So if we're thinking about the responses to wildfire smoke, they might be minor. If you've been around a campsite or been in wildfire smoke, you might have some eye, nose, and throat irritation, those just really annoying symptoms. But as we see more intense smoke events, or if you're more sensitive to impacts, you are going to see these more intense impacts like coughing, wheezing, shortness of breath. You might get headaches, you might get tired, irregular heartbeat and chest pain. And there's data that's showing that we even see an increase in hospitalizations and overall risk of death from wildfire smoke events. And I think it's important to know what the symptoms are so you can start monitoring your body and take steps. But you might not see symptoms either, and you might see impacts later. And the interesting part is we're starting to see data that shows you can have symptoms and impacts from wildfire smoke up to a week after the event started or being exposed. So it's important to be thinking about your body past a smoke event too. And when we think about those impacts, fewer people suffer the most severe impacts. So if you're looking up that triangle, there's going to be less people that die or have hospitalizations, and more people will have the less severe impacts. So we'll see more people have those impacts. But if you, as we see more smoke, or if you're a sensitive group or more susceptible to smoke, you are more likely to also see those more intense impacts. And the people with increased risk are a lot of people. And this list of increased sensitive groups, even in the 4 years that I've been here, has expanded. And as we learn more, the list is growing. So if you look at this list, it's likely you or someone you know, someone you're close to, is probably has an increased risk from wildfire smoke. And even if we just think about people under the age of 18 or under the age of 65, that's already 40% of Washington's population. And so if you look through this list, there's a variety of reasons that people could have increased health impacts, whether it's their life stage or because they have another health condition or just past experiences that can make them see worse in health effects. And the other thing I think we have started talking about more recently, and we're seeing more smoke events, is smoke and mental well-being. Smoke is not fun. Besides the health impacts, it changes our activities. If if you really enjoy running outside, or you have a big outdoor event that has the risk of being canceled, that really impacts us as humans. And so this is a little bit of a graphic. The Okanagan area in the Methow Valley has had really bad summers, 4 weeks of smoke at high levels constantly. And so really starting to think about how to stay socially connected when we have to be inside more. I think the box fans is a really good idea for this aspect, because it really gets you to have some control around your environment. You can build those box fans together with family members and things like that. So now moving into the more of the steps to reduce exposure. So as lower levels of air pollution, starting to reduce your exposure outside. So trying to stay inside. I think we all generally know this. If you are exercising outside, you are breathing in more. So trying to move to lighter activities inside. So walking instead of running. And then as you move and spend more time inside, we have to make sure we close windows and doors to make sure that smoke doesn't get in. But that's really hard when it's also hot. And I'm sure maybe you all started to experience during the heat wave too. It's just also being prepared for heat is being prepared for smoke. And then not adding to indoor air pollution. And kind of going back to Dan's point too, is we have smoke outside. We don't want to add more to our exposure. So burning candles, vacuuming without a HEPA filter, cooking adds particulate matter into your indoor environment. So, if you need an excuse to get takeout and not cook, this is your excuse. And then as we see wildfire smoke for these longer periods or more intense, and we have older homes, the smoke is going to get inside. And the research is showing about 3 days that no matter how you keep your windows and doors closed, it'll start to infiltrate into your home and all the gaps and things like that. So then we have to actively remove the wildfire smoke from inside. So if you have an HVAC system, trying to upgrade that to a MERV 13, and that will clean most of the air throughout your home. But if you don't have that, then we're focused on cleaning your indoor air in a room. And that's where the DIY box fan filter kits or the commercial HEPA portable air cleaners can do that. Who all has a way to filter their indoor home between Wednesdays and Wednesdays? Okay, wonderful. If you don't, I think this is going to be gifted away to someone, and I'm going to let the person who brought it figure that one out at the end. And then if you aren't able to keep the air clean in your home, trying to find an option to seek cleaner air elsewhere. So maybe there's a library that has an HVAC system here. I don't know your county as well. So yes, wonderful. So yeah, seeking space elsewhere too, or a friend, even if you can go for a little bit during that span of the day to just reduce your exposure for a couple hours is really beneficial. And so if you do have an HVAC system, I'm not going to walk through all these. I'm hoping the slides will be available for you all to really dive in later. But these are the recommendations if you have an HVAC system to make it ready for wildfire smoke. And then I will note those were really recommendations for your home system. But if you are maintaining a public building or a larger space, those recommendations are going to look a little bit different. And so the Washington State Department of Health, we have guidance on how to maintain indoor air quality and ventilation in a larger space. Yeah.
Is there any government grants to help that population care?
Yes, there are some grants. I don't know if there's currently any open. So the EPA just had a wildfire smoke community preparedness grant. And I think there's some challenges with applying to grants and maintaining them, and isn't enough money and partnerships. And then from a state level, there's some funding for schools coming through or a little bit. I think the EPA has announced more opportunities, and there's a lot of other types of grants that are out there and will be coming. There's a lot of Inflation Reduction Act money coming through for like this type of work, but grants are hard. So it's not just free, it's free money. It takes applications and things like that. So, but I think there's been a lot more funding there was not a lot of funding for indoor air quality work in buildings for a long time. And then all of a sudden there's a lot very quickly, and it's kind of hard to manage that there's so many now. So if you can take the opportunity, we can talk more about that too, and I can send some links as well. That's a great question, thank you. So it's going to HEPA portable air cleaner. So these are the commercial units, and with either that or the DIY box fan filter, there's some technical things that you have to think about. So if you are going to purchase one, purchasing it now in advance of the season, one, cheaper. Also, when smoke hits, they're not as available, or it's not going to get delivered on time. But there's a lot of things to consider before you buy one, because some people market fake HEPA filters. Some of them produce ozone. We don't want to add another respiratory irritant into your home. It needs to be rated for the size of the room that you plan to use it in. Also, both these options can be kind of noisy. So if you're in a school setting and trying to put them in a space where people are talking, that can also be a little bit challenging. The HEPA portable air cleaners, the commercial units, are a bit quieter than the box fan filter. I was running my box fan filter in the heat, and it is kind of loud. So thinking about that when deciding which option is best for the space that you plan to use it in. And then with the box fan filters, there's multiple designs. More filters are better. There's more opportunity to filter the air. And thinking about if your box fan has the control settings on the outside, on the exterior rim, as you see on that one, when you attach the fans, or you attach the filters, it'll be easier to turn off the fan and things like that. And making sure you have extra filters to replace them, because these filters, the MERV 13s or these furnace filters, will get dirtier faster than the filters for the HEPA portable air cleaners. And for these, if you're going to use them in a childcare setting or space where there's kiddos, they might knock it down. So for these, try not to leave children underattended, or making sure you have to make sure it's away from different objects or from the wall, so it actually has opportunity to bring in the airflow. And these can't be operated in a window either. So if you aren't able to clean your space in your entire home, what we really encourage is creating a cleaner air room. And that's where you kind of pick one room, you seal it off, use a portable air cleaner or DIY box fan filter, and try and stay cool in that room too. And then avoiding other activities. So this is kind of our intervention that kind of combines all those things that I just talked about. But the one thing that is outside of that I haven't gotten a chance to talk about is N95 respirators. And all of us have know a lot about masks over the last couple of years. And what we recommend is if you can't leave the smoky area, you have to be outside, you can't find other ways to reduce exposure, is then to wear a N95 respirator. There's a lot of challenges with them, which is why we don't recommend them as the first step to reduce your exposure. Or if you have to be outside, you can't use the other options. If you wear it improperly, it's not going to provide the protection that it's expected to. And when we think, and respirators don't work for everyone, so if you have a beard, they're not sized for children or created for children. And so we really encourage, if you're going to use one, learn how to properly put it on, so you can get that really good seal, because they work a little bit differently for wildfire smoke than for COVID. In that COVID, for wildfire smoke, you have to have that seal so that when you're breathing in, the particles can actually get filtered through the material, because if you have that gap, they're just going to go through. So that's why we don't recommend surgical masks, or like the cloth face coverings for COVID won't work for wildfire smoke as well. So this is our Smoke from Fires webpage. So this will go into way more detail if you have more questions around some of the things I was just talking about. And I think one thing that we have to now talk about with smoke are other public health disasters, and that's heat, that is COVID-19, or in the future other respiratory viruses and things like that, because it changes how we communicate around the disasters. So if you have wildfire smoke and heat, you don't want to bring in outside air to cool yourself down because it's smoky outside. So finding other ways to keep cool. But it's challenging because I think heat and heat illness can occur really quickly, where wildfire smoke, you might not see that immediate risk till a little bit later, or down the line. So we try and communicate around when we communicate smoke and options to stay indoors, we also are communicating about how to stay safe in the heat. And then when you think about wildfire smoke and COVID, there's some other challenges. We had similar symptoms. If you had COVID-19, breathing in wildfire smoke may make your symptoms worse, or exposure to wildfire smoke can make you more susceptible to other respiratory infections, and that can be other things besides COVID. So I know we're kind of moving to different phase after COVID-19, but in the future, there are other respiratory viruses and things out there that we have to know that, and we have a lot of learnings from how we adjusted to both. So at the state level for the last couple of years, we had a guidance and provided recommendations. And this is where I'll really emphasize having a space to filter your air and creating that clean indoor air helps with both. And so that's finding those opportunities. But what I'll say is, and we recognize that box fan filters, even though they're the cheaper option, or HVAC system or portable air cleaners, all of it costs money. And that is a big challenge in making sure that right now access to clean indoor air is not equitable across our state. And what we're seeing, which I think is really cool from the state level, different community groups or local health across the state are starting to distribute those interventions directly to people in their community and using funds and things like that. So that's, I think, my biggest goal, or would be my goal as we move forward in wildfire smoke response, is access to clean indoor air. So I am going to move in kind of a different section of that. That was the concepts around being smoke ready. What are the basics? And my next section is really decision making. So if you have outdoor events or schools and things like that. Well, thank you everyone for sticking around. I know I had some really cool conversations even in those 10 minutes that I kind of wanted just to share a little bit about. The first one was a little bit more about grants and how your local library used a FEMA grant to do some HVAC renovations and things like that. And so there are other opportunities besides EPA, so FEMA, maybe there's a CDC grant and things like that. So that's wonderful to see that in your community. The other thing that Brett from the fire department, fire and rescue, mentioned was does the state track respiratory related illnesses and hospitalizations and things like that? Is there a way to actually see and monitor those impacts? And we have a statewide system called the Syndromic Surveillance System. It's called Rhino. And your health officer, your local health officer, and the local public health can have access to it. It's not, the data is not openly available to the public, but part of my role during smoke season is to track respiratory related visits, or if there was a discharge diagnosis related to smoke, and see if we can see that uptick in impacts as we see increases in wildfire smoke. And then we talked a little bit about how to stay cool if your only option is to stay with windows and doors. And one thing I'll say is, if you do have to, heat is an immediate threat to health, and it can be very deadly a lot faster than smoke. So if you do need to open your windows and doors and it's that hot, the best thing, if you have an option to filter indoor air, be running that DIY box fan filter or portable air cleaner while you have your doors open or windows, and try and open those windows and doors only when it's like cooler outside. And it's hard. This work is hard. Yeah.
I wanted to ask you about that too. You mentioned it a couple times in your earlier presentation about, it's too hot, maybe you have to open the windows, but everything I've heard is that if it's hotter outside than it is inside, if you open the window, you're going to make it
hotter
inside.
Yes.
So it seems like just clearly stating, if it's smoky outside, whether it's hot or not, keeping your windows closed.
Yes. Yeah, you don't want to open your window if it's hotter outside. Exactly. We were talking about opening your windows and doors overnight and running that filter fan overnight and then closing it, and then trying to do all those other things for heat, like keeping your curtains closed and things like that, and try not to cook at the peak time of day. You have to take all these different recommendations and put them all together and like what works well for you. I can't tell you, I can give you ideas and all these things, but you have to tailor it to your individual habits. Yeah.
I know in the past that I've helped some team members make decisions whether to open windows and doors or not, kind of based on a couple of why.
Yep.
If you're above 150, it's probably a threshold that you need to be mindful of. Even if it's hotter inside, because that can be equally dangerous to heat, is the impact to your respiratory system. there's some passive things you can do that you kind of mentioned as well in your home. Cooler out of the doors, windows, window coverings, or when you pick a room to shelter in your home for a heater, try to pick a non-south facing wall. That's a really important one. Try to find if you have a home that's on a hill. We always pick our walkout daylight basement. That's a really good room to kind of use the vestibule during the heat of the day.
That's a really great point. I like the south facing. I might have to add that to my guidance. And popsicles. So I was talking to someone who really, like in community events and people wanted to have popsicles, and it kind of helps with this heat. So I thought that was a fun idea. Yeah. And then another question, or do you have something else to add, Mike? Okay. Nope. I think it's your question then.
Just going back to the commercial filters, I know during COVID, a lot of things were marketed viruses. Safe to assume that a lot of those things are not actually or
So if you talk to Nancy Bernard, who's our indoor air quality person at DOH, she would say no additive technologies whatsoever. It is not helpful. We don't know. Like it's really the filter, the HEPA filter is what you need. I don't know. I couldn't give you a specific idea of like this additive technology produces ozone. It would depend on the additive technology that you're talking about. But what you can do is there's a link through the California Air Resources Board. So it's going to CARB certified that link is built into this. But you can actually take the model number of the portable air cleaner. Like if you're on Amazon, you grab the model number, you copy and paste it, go to the CARB website, put it there, and it'll let you know if it's approved. And if CARB approved, that means it doesn't produce ozone and doesn't have additive technologies that are bad. But it is, you have to go from one website to the next one to then make sure it's okay. And then if you're going through like 5 models, that can be kind of, that toggle can be annoying.
Could you clarify? I don't understand what additive.
So like UV, if you're adding like a UV light to take out bacteria, ionizing, radiation, things like that is an example. That's a great question.
On that topic, you talked a lot about the DIY box fans as well. And I know that those came up during COVID when people were really paying attention to indoor air quality for the first time.
Yeah.
And you talked about how much faster those filters get dirty. And I'm just afraid that people with the DIY ones, they don't get the red light that comes on or something, so they need to change the filter. So I think that's a caveat that really needs to be focused on.
Yeah.
Do it yourself. So you're losing effectiveness, and I'm curious about the overall cost long term of do it yourself versus have it.
Exactly. That's my concern too. And that's where it's a toss up between the two. So you mentioned the HEPA portable air cleaners usually have a sensor that let you know when it's dirty, or actually some of them have air quality sensors built into it. So it'll tell you air quality is bad, like maybe you should turn it on. And then the DIY box fans, if you have to replace them more, eventually, when does that cost go up? And in the study, I think kind of dives in, and Dan has the paper, kind of starts thinking about these things. The other thing that I'll mention is the EPA study did show once those MERV filters are fully loaded with smoke, they're basically not effective. So once they're dirty, you do need to change it. And if you don't, then it's not. Yes?
An important additive for that. In the Oregon wildfires, talked about getting those, but every place was absolutely sold out. So if you're thinking about that, you need to pre-plan get it.
Yeah, and enough filters for replacement too. It's not just buying one set. So there's definitely pros and cons of each method that you have to think about for each one. I don't think none of this is a perfect solution, but just trying to figure out how to best adapt the way we can.
I have one more question.
Of course, yeah.
I love my CO2 monitor now for inside for monitoring the air quality in general. But is that helpful with wildfire and PM2.5 as well, or this CO2 is not going to? the correlation there?
So no, it's not helpful. You'd have to have a PM 2.5 sensor. So the question is if you had a CO2 monitor, and that kind of tracks, that was the indicator for like COVID and like ventilation and things like that. CO2 is in smoke, but not a lot. So you need a PM 2.5 sensor to actually track it. Purple air. So yeah, and there's other low-cost sensors too that you could use to monitor indoor air quality. But the purple air sensor will pull up on that map. You can add the correction factor, and that's where there's a lot of benefit with the purple air sensor. So you would need to buy another sensor to track it inside. There's some sensors that have both, but I can't tell you off the top of my head. Dan, do you have anything you want to add there?
We do have a list of filter monitoring devices, personal air monitoring devices on our website. We evaluated half a dozen and shared that on our site. Our air monitoring staff, I had several of them. My home actually during the last 2 years set up right side by side. Some were effective, but not as effective. The purple air has proven to be the most reliable and accurate tracking with permanent monitors.
That's a great point. Any other questions on the sensor while we're at it? Okay. One other conversation that I had that I just wanted to mention while we're kind of having these conversations was about the N95 respirators and wearing them inside. While, so wearing a mask is going to reduce your exposure whether you're inside or outside. We typically recommend if you are going to wear it inside, it's maybe you're en route on the bus, like as you're going somewhere else, or if you're in a commercial building. You can wear it when you're at home, but it's just, they're not comfortable to wear for that long of time. So it's just one of those things where yes, you can if it's worn properly, but just when you think about the actual implementation of it, it's not your best option. So really focusing on filtration first, and then if you need to have the N95 respirator available. And we also talked about KN95s. So those do help too. They're not as good as N95 respirators. And so it's kind of like a scale, like best is N95 respirator, then K95 or another respirator approved in a different country, and then surgical masks, and then like cloth-based coverings. Does anyone have any questions on masks while we're talking about it, actually? Oh, yeah.
Since COVID, or during COVID, there's been a lot of studies. Some of those studies are about downside of using masks and breathing your own CO2.
Yep. Yeah. And so there's other things to consider. And if you have, a lung condition or other respiratory things or health conditions going on, it might not be your best option. So it's indoor air filtration is really all I can really emphasize here, is that works for a lot of different hazards. And if it's not smoky outside and you buy that DIY box fan filter setup, you have a fan to keep yourself cool, where the HEPA portable air cleaners won't cool the air at the same time. Think like in a dream world, I would have a portable air conditioning unit that also filtered air, but for some reason, no one's come up with that yet, besides like the full HVAC system. Okay, so I'm gonna go into kind of like the second half of this presentation, knowing there's some people in the room that are making decisions for other people too. So from a state perspective, we have the comprehensive emergency management plan that has a wide variety of hazards, but we do have a specific annex to wildfire smoke and when we have severe response episodes. And so this section that you can go to talks about agency roles and responsibilities. So what's DOH's role, what's ORCAA's role, what's Department of Natural Resources. It goes through things about when to make decisions, how to do indoor air quality monitoring in community spaces. So that's kind of our guiding book for people making decisions. It does talk about local health jurisdictions and notifying people and trying to work with schools or community events. So I'm going to go through a couple different guides, and I'm not going to be able to walk you through every detail of every one of these. So the first group that we think of when we have to make decisions for the public is schools and children and youth activities. And one of the challenges of that October wildfire smoke event was that it was overlapping with schools. So part of fire season overlaps with when schools are in sessions. So what we have, this was developed, this guide, maybe about a decade and a half ago at DOH, and it takes that air quality index and then provides recommendations based off recess, PE, or longer events like practices or games. And then kind of gives you the recommendations. You kind of take both and then find your recommendation in the middle based off those two conditions. Just to highlight two is at unhealthy for sensitive groups is when we recommend to start considering, like to start canceling events and activities, or when we're in the unhealthy, that's when we, instead of trying to do PE, trying to keep all kids inside. I will say that we are actually doing a pretty big revision to this right now and trying to do some updates. And we heard a lot of feedback at the state level on this guide based off the last smoke event. So we did a lot of engagement with schools and principals and things like that to improve this guide and keep recognizing how to make it best implementable in a community. And so we will make sure when that's available, send it out to Jefferson County Public Health, and it'll be available on the DOH website too. And then there's a second page to that guide, and it also goes into more details of why are kids more sensitive, some of the other things you have to consider, what's a light activity versus a vigorous activity, and so how do we scale down the intensity, because the more intense you work out, the more smoke you're gonna be breathing in and more of a dose. Kids also breathe in faster than adults, so one, they're gonna breathe in faster, have more of a dose, and if they're also exercising, that's also gonna go up. And then how do we do indoor air quality monitoring in schools? So there's a section, and actually a couple of these sections will be expanded upon into our revision. Any questions on kind of schools and using this guide? I would recommend kind of looking at it in advance if you work with schools, making sure they're aware of this guide. And if you do have questions around indoor air measurements and things like that, there's an email available to contact us or Dan to you. Everyone, there's a lot of increasing number of sensors experts in our states to be able to help with these decisions. Yeah.
Are decisions about following this up to individual schools, or is it SBI?
So it's at the school level, yes. That is a really good question. It looks pretty different across school districts. So sometimes I've seen school nurses make the decision for activities like PE recess that are during school hours. And then you have athletic directors who are in charge of practices and events. Some districts will make a district decision. Some schools do it differently. They could also work with local health to provide information, though local health don't make the decisions for those. But school closures too, like we've seen one county during a big smoke event just work with school districts to decide to close the school because it was just the wildfire smoke was way too bad. So it's not consistent. Yeah, so this guide is recommendations for locals to make the decisions based off who is making the appropriate decision maker in that setting. Okay. One other guide that we have available is for public health officials, so local health or emergency managers, people that are putting out information or trying to make these larger scale decisions for our community. And it's also based off the air quality index. So thinking about when to put out, it is very hard to read. There are some, and one of the examples is start to put out, distribute health information to the public, and when to think about setting up a cleaner air shelter or when to cancel things, and we kind of integrate some of the recommendations in the school activities guide into this. And then I think one of the most challenging and decision to make is to cancel an outdoor public event that has maybe a big economic impact. And so DOH has this guidance, the wildfire smoke guidance for canceling outdoor events or closing schools, which is a more intense option than the school activities guide, which is modifying, activities but not closing school. So we developed this in partnership with health officers and other experts across the state, went through an engagement process, and this was published in 2019. It was updated last year. And so the level at which you to consider canceling outdoor public events is when it hits unhealthy for everyone. And then when it hits very unhealthy, which is the purple, is to cancel outdoor public events. And that decision's, could be made by a business or whoever's running the event. It could be the health officer who has that authority in your community. And what I'll say is there's a lot of things you have to consider when making that decision. A number, it's more than just a number, than just the AQI. You have to think about how long there's going to be wildfire smoke at that level, because you might see a sensor hit that very unhealthy level, but if it's going to go back down quickly, how long is the event? Is it a short event? Is it multiple days? Our smoke is going to get better or worse. There's actually a cool feature on the smoke and fire map and the smoke blog. So it's the EPA map where you can see a trend in the air quality data. So it'll let you know if the air quality is getting worse or better. And it's kind of like that forecast information. Is there an option to move your event or adjust the time or move it to a different location? Is there an economic impact and other things? If you're making a decision that impacts children, will there be adults to be available as caretakers if you send them home from school? Sometimes school is a safer option for cleaner air than at home, depending on what their at home is. So it's complicated. And so this guide is pretty lengthy and kind of walks through local health officers. That's who it's designed for, to be thinking about all these things when making a decision. And then we have those things kind of in two summary documents, like a one-pager, the idea being your local health or health officer can kind of send these out and be helping think about that. Yes?
Any sort of crosswalk?
Cool. Yes, yeah. So the question for those that couldn't hear it in the recording too is around cooling centers and cleaner air shelters and setting them up and kind of crosswalking that. What I'm going to go back to is we recommend, there's a couple things when you think about that question. We recommend setting up cleaner air shelters or a community space or where people can go to at very unhealthy, so it's the bottom one, for an extended duration of time, consider opening a cleaner air shelter space for the public. And if you are going to have long periods of even orange or unhealthy for sensitive groups, you might want to consider opening that space for sensitive groups earlier. Though there's some challenges with setting up an emergency shelter space. Like, we haven't seen, in my 4 years, I think the best option is finding a community space like a library where people can go to that already go there and enjoy going, and you don't have to have a ton of logistics to set it up. But if you're thinking about an emergency shelter, maybe, we've seen them for cooling or for cold. The hard thing with smoke and just shelters in general is, people getting there, the transportation, the logistics of setting up. I've only seen 2 emergency cleaner air shelters set up in our state over 4 summers, just because it's challenging. So that's like more of an emergency shelter. But the tie into cooling shelters is, just because it's a cooling shelter doesn't mean it will be a cleaner air shelter, because we don't know if that HVAC system has the appropriate filtration on it to actually also keep the air clean in addition to being cool. So DOH has a map, you can call 211 to find a cooling shelter. That doesn't mean you can go to that exact space to also be safe from a wildfire smoke event.
Something we suffer from in Jefferson County.
Yes. HVAC system, yes. Yeah, and that's the hard part is I don't think you're the only county that has that challenge of actually having community spaces yet. And that's where we have to start thinking about how do we create those spaces, and that ties in where do we get funding to create those spaces too. Do you want to share anything about that? Not to call on you, but this, I think this might be, if you want to talk about the library, maybe it's good.
Sure, I would just add on to that one of the challenges. So I have an 11,000 square foot building with air conditioning and clean air, but we're in a space that is not easy to get to. So for us, I mean, getting people out with transportation is also add on. The other thing I would say is that, you know, we are open 7 days a week. That's good, but we do close. And so the challenges we've had in the last few years have been, yes, at 7 o'clock we're closed, or the weekends we're closed at 5. That doesn't mean the smoke is not right, or it doesn't mean that the heat is necessarily gone down. I don't have funding to continue to staff or add more hours, but I think as we talk about funding for disaster preparedness, if there were funding available for that sort of thing, my type of facility would be a great resource for that, because we could stay open longer and do that sort of thing.
If you had the resources to do it.
As it sits right now, getting people to their challenge and then keeping it open more hours. But it is the type of facility that does all.
Any other thoughts or questions kind of on that, or discussion points?
I have a question about, I guess, again, understanding clean air inside some of these public buildings that might be more challenging. I'm wondering if there's been studies that you guys have about passive ventilation. My idea, the best idea is inlets down low and then, you know, venting out up high, right? So warm air is going to rise. Have there been any studies about how the 2.3 and 2.5 acts in some of those passive ventilation systems?
That's a great question, and I don't have the answer to it. But yeah, I will write that one down, and I will follow up actually about that. I think that's a really interesting point. And I would guess there's, the research around wildfire smoke is definitely increasing more, but it's not where, it's not at the level for other types of air pollution. So traffic-related air pollution has been around, or ozone, a lot longer than really intense wildfire smoke events. So we're starting to see that body of research around health impacts or interventions and those things for wildfire smoke increasing. But I don't always have the answers to every question that people have yet. But it's a good one. Yeah. Yeah.
You said if there's any other thoughts or what she shared, I thought on that. With only 4 cleaner shelters in the last couple of years being open, she brings up a very important point that there are people that do have facilities that are willing to go the extra mile. And so my thought was just that after the meeting, if people need the back corner to have a facility, or she's volunteering or coordinating or making that bigger, I mean, that's not a cry for help. That's a beacon of like, we got the bat signal. If anybody wants to help recognize what the bat signal is, like, we can coordinate with other people. We actually start movements. Jefferson is actually the best place to be. It actually has cool air and clean air shelters ready to go.
And that's a wonderful idea. I think that's why I think it's just so amazing that Jefferson County Public Health set this up, because you can start having those conversations, meet those people. Because while I might be able to provide guidance, I'm not the local level to like do those things and actually create that community change. Mike?
Yeah, I can you can look about the information table afterwards. Kind of network.
Yeah, in the back.
I'm new to the area. What library are you talking about? Jefferson County Public Library. Yeah. It's the best.
But that's Carnegie. Nobody recommends Carnegie.
Oh yeah, we love this. Great. All our libraries.
Okay. The one thing I'll just point, this is our other website, or it's on the Smoke from Fires website. It's just a subsection, but this will have all of the guidance that I talked about, the more technical guidance and those making those decisions and things like that. It has the emergency response plan. So that's where you can get into all those details. And I think we'll make the presentation available online after. So you can find that. The other thing I would like to plug is before we kind of, this will be my last slide if we want to go more into questions and discussion, is this concept of smoke ready is increasingly the last couple of years we're trying to promote it, and there's some different Northwest, Dan and I are both members of the Northwest Air Quality Communicators Group, kind of started this concept of let's have a day or now a week to really promote this idea and put out social media and things like that. So this year it's June 12th through the 16th. So if you all do communications in your community, I think it'd be cool to do some around preparing for wildfire smoke season. So we are still doing, Dan and I are still doing the planning around that with some other people in our state, and we'll make sure that information gets to you all. And so just stay tuned for that. And that is my last slide. And you all already, and then this is my contact information. I'll put that up for a second, and then it'll be in the slides too. And we all started having some great questions. So maybe there's more, maybe there's not. Mike, do you have anything to add before we jump into more questions?
Very comprehensive there. See if there's demo questions, and not, we have time to stick around. Questions, Kaitlyn?
Yes.
Yeah, there's tends to be a lot of information focused on the needs of younger children. I understand that. I'm dealing with a group of older adults, and I treat them like younger children. People over 65 are at increased risk too, and will have worse health impacts, just like younger children. Some of the things you might be thinking, like different lung diseases and diagnoses, might be more common in older people than in children. And so, but can't really tell other adults what to do sometimes. It's hard to, but yeah, but they listen to you. And that's like finding a voice and a leader. It's great for you to advocate for taking extra steps, because yes, older people have more at risk. I saw that hand first.
Questions, as long as you have. But I'm wondering if you know at all, do you have any access, I guess, information about how much PM2.5 is created by cooking at Thanksgiving dinner or cooking other indoor stuff? I just feel like more analogs for folks to compare to doing their own indoor air quality versus smoke.
Yeah, we do have some data around cooking inside. I don't know off the top of my head, I couldn't give you a number. If you cook for this long, you produce this much PM2.5, but you do increase levels. And I've heard some anecdotes. Like one of my office directors got a purple air sensor and was cooking. She's like, oh wow, that actually increased a lot higher than I was expecting it to. Where you might see, but the thing is they're short spikes. So as you're cooking, and it's really important to have your vent on, if you can, to pull out that smoke as you're cooking. But there's probably a little data. I think it's a great comparative, trying to get people to understand those examples to change behavior is really interesting. Do you have a...
Just anecdotal on that. I found my nose is a really good smoke. So insects goes up, cooking goes up. And what's that thing you burn?
Sage?
Yeah, well, say, yeah.
Or incense, yeah. Yeah.
But it's temporary.
It is temporary. Yeah. The other thing that I'll add to that list is essential oils aren't the best either. They produce indoor air quality or scented products too. So if you're spraying things, perfume, cleaning supplies, do add to that short burst of exposure to some other indoor air quality pollutants. The question.
My professional past has been so my question is, is there any support for long-term care facilities or congregate settings for folks who are not well? I mean, granted, most of the few places that are in our community have air conditioning inside, and I don't know what sort of filtration they have. But I know that during COVID, propagation of, let's say, I just wonder if this topic with regard to those.
Yes, so the question is around support for long-term care facilities, recognizing that older people are more sensitive to wildfire smoke, and kind of if DOH or there's been support for that. We actually got some grant funding to go into long-term care facilities and ask them about their practices around filtration and cooling and things like that to figure out what is kind of the state of wildfire smoke and the impact on long-term care facilities. So my team and the other side of DOH that does more of the infectious disease side with long-term care facilities have been having a lot of conversations around if we are improving indoor air filtration and these other things for COVID, thinking about how do we actually also mitigate for smoke at the same time. We're kind of in that learning phase still, and I think the goal is to have more recommendations and guidance specifically for long-term care facilities around heat and smoke and COVID or other respiratory infections. I don't know of any direct funding yet specifically for smoke and long-term care facilities, but I think it's been mentioned a couple across different facilities outside of long-term care, like schools or libraries, there was some use of COVID funding in these settings too, that, when it comes down to filtration support, reducing smoke mitigation too. So yes, and more to come, I'm hoping.
I just want to add that we are undertaking a community wildfire protection planning process. I'm one of your county commissioners and on the Board of Health with Commissioner Brotherton, and we're going to kick off meeting for it on Thursday with our consultant, but we'll be communicating about that over the coming months. And Chief Black from East Jefferson Fire and Rescue has been part of that planning team. So that's a related topic here is how we make our community more resilient to wildfire, and we'll be digging into that over the next 6 months. So that's something to keep your ears and eyes tuned for.
That's wonderful. I saw Mike's hand first.
Well, so I just wanted to make sure I got one thing straight, because you mentioned that the guidance for schools, some revisions, and that when those are revised, that'll come on the smoke wildfires.
Yes.
Then the guidance for outdoor events, which is another guidance document. I can't remember if you said, are there any revisions planned in the near future on that, or what's on the toolkit page, what's likely to around this summer?
So the school activities guide revisions or children's activities in schools or camps and things like that will be available, and we'll make sure we do some communications around that. This guidance, so the threshold to cancel outdoor public events and discuss school closures isn't changing in that process. So those two thresholds were a separate engagement process for this guidance. When we update the school activities guide or those revisions, if those recommendations are in the closures guide, they'll just be merged over to it. So just so they align in it, but the two bottom thresholds aren't going to change.
How do we find that document? I don't see the website.
It's on, if you go to this website, so the Smoke from Fires Toolkit, it is, the Wildfire Smoke Guidance for Canceling Outdoor Events. I had a wonderful idea to do QR codes on all these slides to links this morning, and I just didn't have time to do that. So this was my trial run, that's my new idea. So I'm gonna change that. But yeah, if you look up DOH Smoke from Fires Toolkit, that link is gonna pop up for you. Yeah.
This, so we have a lot of people in the room here and they have a lot of resources. So we were planning for emergencies. There's a lot of buildings here that already have air conditioning. They got good quality filters in the commercial segment and also in our faith community. Our church, by the way, upgraded our HVAC system so it's like hospital quality air. But there's no central repository where people can say, well, Rose Theater, has got this kind of quality, this restaurant is like that, or this shopping area, or this grocery store. so to speak, so people can go to places at least nearby where they have access, so they can at least, you know, get some relief if they don't have any options. So I hope we're going to have a collection of possible resources or some.
Yeah, people are gonna be over there.
Yeah, faith buildings are a big one. And yeah, but it's having the information consolidated and available to the public.
Yeah, we've got several thousand square feet that, you know, available.
Yeah, thanks for mentioning that, because I know recently talking to our emergency preparedness folks, they mentioned they're working to coordinate more with the buildings as possible. That really works on out about areas. I think probably, you know, some sort of needed, you know, all the different that they were the goals that we're trying to do part of that. And, keep coordinating.
Sharing information and communication is a lot cheaper than doing the whole retrofits. And if they're already existing, just getting that information out is a lot easier. Yeah.
It would be helpful on this list to have how you create a wildfire smoke shelter. There's lots of cool shelters around, some of them are already, like the library, you know, really effective wildfire sheltering as well, wildfire smoke shelters, if there's staffing or what have you. But having a little punch list to say, you know, check what's the ventilation, what's the HVAC, and, you know, oh, well, if it's a 1,000-foot building, you have this many, you know, our HVAC filters.
Mm-hmm.
It'd be helpful for communities.
Yeah, we've gotten that request before, and it's on my list of things to do. And we had a grant project. We were partnering with another county who was looking at homeless shelters and creating cleaner indoor space in those, and hopefully to take some of those learnings and some of the other things that we've learned over the years, and hearing from you all as needs to be in that guidance. So I'm going to put that one down. And I know the CDC has some high-level guidance around it too, but I think there's a trying to make it more tailored for our state too is always good.
Greg, if you guys at the county level can put that together for the county, we can all share it. We have on ORCAA's website, we have lists of alternatives to burn places to take yard waste. So we can have a list of clean air shelters per community. Things to keep in mind is though, it's not just a good HVAC system. It's a good HVAC system with MERV 13 or better. The most common filters in commercial buildings are MERV 8 through 11. So just make sure your HVAC system is up to code, and not every HVAC system can handle a MERV 13. It's a much finer fact. So.
Yes.
Another resource that often gets kind of overlooked because it's so massive is that you've got a really good job of getting frameworks of how to put different kinds of shelters together, how to prepare yourself individually as a religious group or a community group.
So ready.gov was the website, though I don't know if they have a whole bunch of wildfire smoke information yet. A lot of preparedness and planning has been really focused on fires and like the direct threat of fires, but we know we can have smoke without fires. So one of the things I've been trying to share is when you think about wildfire planning and preparedness, it's also about smoke, and that looks a little different. So trying to think about for both. Yes.
So again, new to the community. But if I sign up with my email address over there, will I get all the tidbits about what's going on in that corner of the meeting? I mean, who do I notify, or how do I sign up for continuing emails about this kind of stuff?
Yeah, well, so locally, best option is to go to Jefferson County Public Health.org. There's a notify me button. You click and sign up. Actually, several different things you can sign up to all public health notify me Jefferson.org. And I didn't, I'm not sure on the sign up. Thank you. I did put your email on there. I don't think I want to go into a list, so it'd be best. Then you can subscribe and unsubscribe. Is there anything statewide that?
At ORCAA, if you want to get updates on air quality issues, you can sign up for the same type of email alerts through our ORCAA website, ORCAA.
That'll be the same website where we post this. It'll take us probably a couple. Might be able to get the slideshows up. Video. Probably be posting it on. That might take.
Of course.
And I'm just going to add, I forgot to mention it earlier. Since we talked about box fan filters, DIY box fan filters. I've heard a couple DIY hacks that are addressing some of the concerns here. So the lifespan of the filters, first is easy. Use a bigger filter. Use a 2 or 4 inch whenever possible. You get more heated air surface area. They last longer. But also, you're looking for a MERV 13 for PM 2.5 protection. But you can put a pre-filter on. Use a MERV 6 or 8. Filter out all that dog and cat hair we have in our homes, the bigger particles, so that it's clogging up that cheap $2 filter instead of that expensive $20 filter. You can peel that one off, throw it away, and keep that big stuff out, and let the MERV do what it's supposed to do. That's one way to extend the life. A cooling tip that actually came up at the regional smoke management conference in Seattle a few weeks ago was using those Corsi Rosenthal box, so the multi-filter boxes, get a Rubbermaid bucket, put a big block of ice in it and set it in the middle. And when you lock down your protection room, you've got a little bit of natural cooling out of that filter, or out of that fan through the filter. Exactly. It's how,
Yeah.
So I gave up my box fan because it was so much easier to work for. Just temporary. I log the number of days that it's in there. I don't need it all the time. Waste that expense. When I realized I'm doing the whole house, it just seemed to make more sense.
To
filter the house rather
Yep.
than the room.
Of course, yeah. The best option is to filter your house if you can, but not everyone has that option too. Yeah. But yes.
Yeah, and that's actually something I've done. I've been in our current house for 3 years now. We had an electrician come out and adjust our furnace so we can turn on just the fan without the heat unit, so we can use the fan through our MERV 13 to filter the whole house.
Does the heat pump extract in 2.5? Or just free on your?
Yeah, you have a filter in the air handler. So a heat pump, you're just using the air within wherever your air return is. Usually the air within the house. You're not pulling any external air in unless your air return is. And actually, thanks for bringing up heat pumps. ORCAA does have a grant from the state that we replace or remove old uncertified wood stoves to get that 2.5 out of communities. And right now, through the end of this fiscal year, so through June, the replacement program is only in Jefferson County. We're hoping to expand that out here so that we'll be able to offer grants if you turn in an old wood stove to get up to $2,000 for the installation of a new heat pump, ducted or ductless. So hopefully by next summer, fall, we'll be able to offer that to us. That way you get heating and cooling both.
Any other questions? Or we can save the last 15 minutes for the kind of the one-to-one and local conversations.
Thank you.
Of course, thank you.